We have kind of done some of these things, especially operative permit, which is kind of an encapsulation of everything, of the dangers, the risks, and what to expect. And why would we make you do that 2 or 3 or even more times? I mean, some people end up doing it several times because they've read it in the book, they do it by hand and send it to us ahead of time, then you do it the morning of surgery. Well, let's talk about some research on what we like to call the public. Does any of you all work with the public? Can I get an amen out there for the public? Okay. All right, here's a story. If you imagine that a doctor told a patient something ahead of time, it would be, you kind of think they would probably retain some of that or something. But the research has looked at actually how much of what we tell you ahead of time you actually remember and how you remember it. So there's a whole bunch of studies on this, and it's all very interesting. But maybe the one thing that might be worth hearing about is a study where they took some ophthalmology patients. Sure. They took some ophthalmology patients and they gave them a preparation with a surgeon reading from a script and a video camera like this videotaping the discussion ahead of time. So the surgeon read, just read from a thing. Okay, it had 20 things on there, and number 15 or something like that is, you're going to have anesthesia for this cataract operation. So it's a very minor eye operation. And there's always a potential risk, although very small, that you might die during the surgery. So, we don't think it's going to happen, but it's a potential risk. Okay, so they did several hundred people. They brought them back at 6 weeks, and they gave them a test. And they asked them 20 questions. They said, did this, and there was a Dr. Nice. And question number 17 was, did the doctor explain to you there was a possible risk that you might die with the surgery? Of the group, 50% said absolutely not. The doctor did not say that, which is kind of understandable. Maybe half of the people didn't remember that. But then they brought them in to grade the test, and they said, half of you said that the doctor didn't say that. And remember that he was reading from a script, and there was a videotape, so we can document what he did say. And so at this point now, do you remember and do you believe that he actually said that? And half of the half still said, I can tell you absolutely, there's no way that he ever told me that. And so what we find is that people, of course, retain only a small amount of what we tell them. And we know we can do some things to improve retention. One is if you read something, it helps. If you read it and hear it, that improves the retention. If you read it and hear it and then write it, that improves retention. And so our goal is to recognize, first of all, that bariatric surgery right now is very controversial. Right now, you could find another very good doctor who would say the best thing to do is to have a lap band. And I don't agree with that, but they're very good doctors, very well trained, they care for their patients, they're not bad people, they just have the difference of opinion. You could go another couple of blocks and see another doctor who says, no, not the lap band, you should have a Roux-en-Y gastric bypass. And you met a doctor like that. And I assume he was a nice guy, good person, but just had a difference of opinion.
Had success.
And has had success, right, exactly. You could go a little bit further and you could find somebody who prefers a surgery called the biliopancreatic diversion. You could go a little bit further and you could find somebody else who's now in favor of what's called the sleeve gastrectomy. So our operation really is a little different than, say, hernia repairs or something else. So we do put you through a lot, and we beg your forgiveness on that. It's our intent, number one, to try and make sure that you're really well informed, but the other thing is to try and protect ourselves against people who say, well, I was never explained that I might lose too much weight or something like that.
It isn't that I didn't want to do it, but it's my background. I was in the military. I work with nuclear weapons. They give you one, you get tested every day.
Yeah. So
you just do it right.
Right.
And so when you do it 3 times, and with my background, it's like, so it's me more than you.
No. I think it makes perfect sense. If I was willing to trust you with nuclear weapons, then I would also trust you with this. But there are a lot of my patients I wouldn't trust with a nuclear weapon. You're probably a little different. Sure. Other questions?
Yeah.